The legendary Jane George, again, wonderful human being that I've got to meet through this process, registered social worker, social workers change the world, and she's fulfilled the role of Director of Allied Health, both in Aotearoa, New Zealand and in the United Kingdom, and she's created all sorts of remarkable alignments between health and social policy development for universities and for governments. She's also an expert, and I'm a bit obsessed by this, about rural health workforce development, obsessed, and I'm really excited, colleagues, to hear her presentation today titled What Allied Health Practitioners Tell Us Matters When Choosing Rural Health Roles. Off we go, Jane. Thank you so much. Good luck. You are amazing.
Kia ora, Tara. Tēnā
Moana.
koutou, tēnā koutou katoa. Ko waio. Ko koti rāna te whakapaparanga mai, engari ko waitaha te whenua tupu. No Brian George taku papa, no Naisby ia. No Nolene Tippin taku mama, no Granity ia. No Morven aho, kei au te tahi aho e noho ana. Hei tangata tiriti aho, a ko Aotearoa toku kāinga he mana no te tiriti o Waitangi, ko Jane George taku ingoa. In 2016, I was the Associate Director of Allied Health Scientific and Technical at Te Tai Potini, what was then the West Coast DHB, the only completely rural health district in Aotearoa. I was operationally and clinically responsible for 26 discrete health professions and the most senior allied health professional on the coast. And we had a real problem. Our workforce was small, and any challenges we had with recruitment and retention had a huge impact for the approximately 23,000 people who lived across our district. The research at that time about rural workforce was largely focused on the medical workforce and focused on testing rural origin and rural training. That is, whether doctors are more likely to work rurally if they've been born or trained there. Now, I could see the logic in that, but I knew that being born rurally or trained there wasn't going to provide the numbers we needed in the short term. And I felt that there must be more to successful recruitment and retention than that. So I set out to find out, speaking directly with allied health professionals who have worked in rural settings to find out what really matters to them. My recruitment resulted in 55 people volunteering to take part in the study. My sample was drawn from a general population sample of adults who self-identified as allied health professionals with rural or remote healthcare experience. 18 participants were chosen using a purposive sampling method to capture voices across a range of professions and ethnicities. Now, as you can see, they were located across Aotearoa in rural areas R1, R2 and R3 as identified in Aotearoa's geographical classification for health. What you can't see here is that they were all women, rural women, who wear many hats alongside their professional roles as allied health professionals. Some were mothers, volunteer ambulance or fire and emergency officers, bus drivers, committee members, and the reserve army of primary industries through which rural communities provide the backbone of our country. My research was grounded in social justice theory, and I used Sally Thorne's interpretive descriptive methodology. Cooper Ryder and Whitney's appreciative inquiry approach was used during semi-structured interviews, and the data collected was analysed using Brown and Clark's reflexive thematic analysis. This analysis revealed 3 interconnected themes, which determine whether allied health professionals stay in rural practice, with a concept of fit weaving through them all. The first theme, safe and supported practice, emerged as critical. Rural allied health professionals need proper tools, connectivity, and professional support to deliver quality care. They need leaders who understand rural realities. One participant shared how their manager spent a day in their remote clinic during a staffing crisis. Within 45 minutes of being here, she had 2 assessments to do. She went home after a 10-hour day enlightened and better connected to her rural community. Sense of connection and belonging, the second theme, is about feeling genuinely connected to team, community, and environment. One participant captured this beautifully. I'm thankful to be here. It's good to know you're where you're supposed to be. This connection extends beyond the workplace. It's about being part of the community fabric, building networks and contributing in ways that utilise unique skills. The third theme is about creating roles people want to come for. Rural roles must offer professional satisfaction through variety, growth pathways, and autonomy. As one participant noted, I want to stay rural because of all the unique things that make rural practice what it is. Many valued the chance to work across diverse age ranges and conditions, something not always possible in urban specialist roles. Underpinning all these themes is this concept of fit, that intangible sense of alignment between your values, the role, and the place. When an allied health professional feels this alignment, they describe it as it's like my dream job with greater life satisfaction. These findings tell us that successful recruitment and retention isn't just about financial incentives or bonding schemes. It's about creating environments where allied health professionals can connect, feel supported, and grow professionally in ways that align with their values. So how do we build a defiant future for rural allied health, applying these insights? My research produced practical recommendations for 5 key groups with the power to create change. Organisations need to challenge urban-centric thinking and champion rural allied health professionals, ensure equitable access to professional development, create clear pathways for rural career progression, and design policies that acknowledge rural realities. Recognise that rural generalist expertise is as valuable as urban specialisation. For line managers, relationship is everything. Spend time in remote locations to truly understand your team's context. Model boundaries, support professional growth, and build trust by assuming good intent. As one participant put it, I would rather work with pen and paper and no resources for someone who gives a damn. Professional bodies and regulators can make a huge difference by formally recognising rural generalist practice as a valuable career pathway. This gives mana to the unique skill set required to work across diverse needs and contexts in rural settings. Training institutions need to examine how allied health education can be delivered closer to home for rural rangatahi, our young people, develop rural immersion programs and rural generalist pathways that prepare allied health professionals for the realities of rural practice. For recruiters, remember, you are the window into your organisation's culture. Know the professions you're recruiting for, connect start dates so new staff can connect with each other, and recognise the importance of supporting partners and whānau, their families, to settle into the community. The power of these recommendations lies in their interconnectedness. When organisations, managers, recruiters, educators and regulators align their efforts, we create rural health systems where allied health professionals want to work. By implementing these changes, we aren't just addressing workforce shortages. We're building the defiant future our rural communities deserve, where skilled allied health professionals feel valued, supported and able to deliver their best care. Nō reira, tēnā koutou, tēnā koutou, tēnā koutou katoa.
Right. Jane, I'll follow you anywhere. So the first thing you need to know is wherever you're going, we're all following you, right? That is profound. I've written about 8 pages of notes with 70,000 questions. Can you hang around for the question time in the next little bit? Is that okay? Jane, again, you need to be running the world. You need to be running Aotearoa New Zealand, and you're really creating an intervention in allied health. And you'll see a wonderful woman by the name of Eunice, who we're going to be meeting shortly. Eunice, I think, has also become your biggest fan in the history of the world. So we're all going to follow you anywhere. You're the best, Jane.